Do you really need a crown after a root canal? You just finished your root canal, there's no more pain, the infection is gone, and your tooth is fine. Problem solved, right? So why does your dentist recommend a crown after the root canal? Is it really necessary? Not always. It actually depends on the tooth. I'm a dentist with 16 years of clinical experience, and in this video I'll show you which teeth need crowns, which don't, and what you really need to pay attention to if you're thinking about skipping a crown after a root canal. So, crown or no crown? Dental crowns are invasive treatments. They require significant tooth preparation, meaning the tooth has to be cut all the way around. And they're also expensive and usually need multiple appointments. So it makes sense that you want to avoid them. And in some cases, you can. But it's really important to understand why they're necessary in the first place. The truth is, a crown does something completely different than a root canal. A root canal is meant to eliminate infection and pain. A crown is meant to make the tooth strong. It's like a protective shell that prevents it from breaking. And it's needed because when a tooth undergoes a root canal treatment, it becomes much more fragile. Actually, by the time your root canal is done, there's often not much tooth left. When we do a root canal treatment, we clean out the tooth. And when I say clean out, I mean remove cavities that are often very large and sometimes old fillings that are damaged. And on top of that, we have to create an access opening to reach the canals and the nerve inside the tooth. In other words, we have to drill a hole right through the center of the tooth. And all of this takes away a significant amount of tooth structure, so significant that your tooth ends up with very thin walls that by no means can handle normal chewing forces. So the issue is no longer pain. The issue is fracture, and these fractures in root canal treated teeth don't come with a warning. They're often sudden and deep. Sometimes so deep, there's nothing we can do to save that tooth. All that time and money you invested in a root canal is now lost because now the tooth has to be extracted. So a root canal does not make a tooth strong again. It simply removes the infection, but the risk of losing the tooth is still there. So how do we prevent this? With a crown. Does this mean you always need a crown after a root canal? No, you don't. So which teeth really need a crown after a root canal? The short answer is molars and premolars, your middle and back teeth. There are some exceptions, and I'll get to those in a moment, but in general, back teeth, especially molars, almost always need a crown after a root canal, and that's because they do the heavy work of chewing. Back teeth are designed to crush food. They handle very high chewing forces, and when they've been hollowed out, like they are during a root canal, those forces can cause the walls of the tooth to flex and split. Even if we replace the missing structure with a filling, we can't restore the original straight of the tooth. So if your tooth is a molar or premolar, the ones that work during chewing, the only thing that can prevent those walls from breaking is a crown. What about front teeth? Can we skip crowns on them? Sometimes we can. When it comes to front teeth, a crown may not always be necessary, but only if the tooth is mostly intact and normal bite forces are present. That's because in a normal bite, front teeth don't handle strong chewing forces. They're designed to cut, not crush, but lower risk doesn't mean no risk. Sometimes a strong composite filling is enough, but let's say your front tooth has two cavities, one on each side, or it was hit and you broke a large portion of it. If you had this damage to the hole from the root canal, remember the access hole we talked about earlier? That tooth has already too much damage, even for a front tooth, and you'll need a crown there. So if the type of tooth alone doesn't decide the need for a crown, what does? The key factor is actually the amount of force that tooth needs to handle. If there are strong forces working against that tooth, the crown is essential. The most common example of excessive forces is grinding and clenching. These forces aren't just stronger than normal chewing, they can last for hours and they're often sideways, which teeth are not designed to handle. A tooth under grinding is under extreme load, which means a very high risk of fracture without the protection of a crown. Another high-risk situation is when the opposing tooth, the tooth that works against this one, is an implant or has a ceramic crown itself. Ceramic materials like zirconia are very hard and very rigid, much harder than natural teeth. Natural teeth have a little bit of flexibility, they can bend slightly under pressure, but ceramic doesn't bend, not even one bit. So if the opposing tooth is ceramic, it's like an hammer pounding on our root canal treated tooth. And implants are even worse. Not only they usually have ceramic crowns, but they also don't have a periodontal ligament. In a natural tooth, the periodontal ligament that surrounds the root acts like a shock absorber, like a small cushion, and it also has these little receptors that allows us to feel how hard we're biting. Implants are fused directly to the bone without any ligament in between, so you don't get that natural feedback. And without that cushion effect and the ceramic on top, your root canal treated tooth basically gets hammered every time you bite. So if you don't put a crown on it, chances are it will break. But there are also low fracture risk situations where a crown after a root canal may not be necessary, even in back teeth. For example, when the tooth biting against it is a denture, in senior patients with reduced bite force, or when there's just no tooth to bite against. A senior, small framed woman with a full acrylic denture will have a much lower bite force than a younger adult with bruxism. The risk of breaking a root canal treated tooth in this senior patient is in fact lower because muscle strength decreases with age. Acrylic dentures are softer and denture movements help dissipate pressure. So it's not a rigid high force bite like natural teeth or ceramics. In those cases, even a root canal treated molar, even with significant loss of structure, may function well without a crown. So when do you really need a crown after a root canal? When your tooth has to work hard in your mouth. Back tooth probably needs a crown. Grinding probably needs a crown. Opposing implant or ceramic crown probably needs a crown. And when is the crown less likely to be necessary? In front teeth with little damage, when chewing forces are low, like in senior patients with dentures, or simply when there's no tooth to bite against. Now, here are 5 quick facts people usually get wrong about root canals and crowns. Most root canal failures are actually fractures, not reinfections. Patients think the root canal failed, but often the root canal was fine. The tooth cracked because it wasn't protected. Pain is not a reliable guide. Many patients say it doesn't hurt, so it must be fine, but root canal treated teeth often don't hurt before they break. Postponing a crown increases risk. The longer you wait after a root canal, the more chewing cycles that tooth goes through, and the higher the risk of a crack. A big filling is not the same as a crown. Patients assume large fillings make teeth strong, but in reality, fillings only fill empty space. And finally, a crown doesn't guarantee survival, but it gives the tooth a much better chance. Please don't forget that every case is unique, and individual evaluation by your dentist should always prevail. If you already have a treatment plan and want an unbiased second opinion, I'll leave my email in the description so you can contact me. And if you need a root canal treatment and want to know the real risks, watch this next. And I'll see you on the next one for another fresh take on every bite.